Good evening. My name is Maron, and we will be discussing the Community Health Assessment Project, focusing more on the city of Fort Lauderdale, Florida, and the HIV epidemic happening right now. Fort Lauderdale, Florida is a coastal city in Broward County, give or take, with a population of about 190,000 people. Fort Lauderdale is known for beaches and boating and canals and tourism. A lot of people love to spend outside when they're here in Fort Lauderdale. The median household income in Fort Lauderdale is about $80,000. And the most major crucial chronic health conditions that happen in Fort Lauderdale, according to CRESHI 2024, would be diabetes, hypertension, COPD, hepatitis C, and with the condition we'll be focusing on, HIV. So HIV is a huge issue here in Fort Lauderdale, Florida. Fort Lauderdale has the second highest infection rate in the US according to the CDC. Now, a lot of the risk factors and barriers that have caused this epidemic to be at an all-time high here in Fort Lauderdale, of course, includes unsafe sex, healthcare inaccessibility, socioeconomic disparities. The most at-risk group for HIV, according to HIV.gov 2022, includes the LGBTQ+, minorities, those of low income, and unfortunately, sex workers. Now, with HIV being at all-time high, one of the biggest things in Fort Lauderdale and in general in South Florida, it's a very big tourist city. With that, there have been a lot of clubs that have been made, lounges. It's very known for partying and drinking. And because of that, the risk factors go even higher, because what causes most people to contract HIV or lead them to being at risk for HIV includes smoking, which about 18.1% of the South Florida / Fort Lauderdale population binges in. Binge drinking is another issue as well, where about 18.1% participate in binge drinking. Again, with the issue of Fort Lauderdale being such a party city, this is something that kind of goes along with it hand in hand. The last thing that puts HIV with risk factors includes the use of drug uses. Now, a lot of these people are either smoking marijuana, cocaine, fentanyl. They use a lot of drugs that puts them at risk for HIV. Also being noted that there's a lot of drug sharing with needles, which puts people more at risk for contracting HIV. Now, the goal of this entire project for my community is addressing this huge HIV epidemic that we're having currently right now. Now, I split my goals into two types, which includes, as you can see on the right side, long-term goals, and on the left side, short-term goals. Now, with our short-term goals being completed within, I'm hoping and predicting in about 6 months, this would include expanding testing sites for HIV, the distribution of free condoms, and most importantly, like any nurse's role, education. Really want to emphasize on the educating part, and being a melting pot of a city, it's very important that with the education, it comes in several languages. That includes English, Spanish, and Creole, which are predominant languages that are spoken in the South Florida area. Now, with long-term goals being completed within 6 months to a year, We want to reduce new HIV cases by 15%. That is the goal. This can be completed through partnering with clinics and the LGBTQ groups, providing free medication citywide, and increase viral suppression among people living with HIV. Now, those are our goals, ideally, for addressing HIV. Now, implementing these plans, one of the biggest things that I concluded would be pop-up health booths at community events. Now, with these health booths, a study by Red Med Urgent Clinic showed that setting up these health booths at local events, farmers markets, health fairs, community festivals are extremely profitable, just because more than likely people who are in big community settings would like education at these places as well, just because they are already at that place. It's a lot easier than going out of their way to go to clinics. Now, with these pop-up health booths, it's very important to staff with friendly volunteers and health educators who can hand out condoms, answer questions, as well as share printed materials, whether, again, as we spoke previously, in different languages, which include Spanish, Creole, and English. These common community events would address and speak with different groups, sexes, genders, and races. There's not one specific group we'll be talking to, but overall, everyone as a whole. Now, the next implementation plan includes mobile testing units in undeserved neighborhoods. We would do by sending a mobile van equipped with rapid HIV testing, counseling for education as well, and information guide for care referrals. We would set up weekly routes that visit these undeserved areas, particularly in communities where people face transportation or stigma barriers. Like spoken before, we would offer these services in English, Spanish, and Creole, which are common languages, again, like previously mentioned, spoken in Fort Lauderdale. The last plan would be HIV testing during routine checkups. Now, with this plan, I would want to partner with different primary care providers, and in the future, long-term wise, when I become a nurse practitioner as well, implementing this in my practice and office, we would make HIV screenings as a standard part of yearly checkups. When these checkups happen, it allows patients, we would only allow patients an opt-out option instead of an opting in, which makes it a standard for all. And if they didn't want to be tested, then at that point they can opt out. So this will normalize testing and help catch cases a whole lot earlier compared to patients who wait long term and then see that their CDC numbers or whatever the case is relatively high. Now, when it comes to interventions and carrying out these implementation plans, we would want to team up with local clinics to give out free condoms and then share easy to understand information about HIV prevention with at least 2,000 people. Now, we're not saying this would be completed on the first day, obviously, but ideally within 3 months, reaching to 2,000 people with this information and education as well. Secondly, spreading awareness. Like said before, nurses, one of our biggest jobs will always be to educate. So we would educate by spreading awareness and then providing in-person education seminars in classes, jobs, and clinics. It would be very important to increase testing options, and more importantly, for a lot of people who can't afford treatment, finding options to either give free treatment or low-cost treatment. This would have to be partnered with, your local government to receive grants to provide finances for medication and treatment. Again, like previously stated before, adding HIV labs to yearly physical checkups, every 3 months for those who are sexually active, and then monitoring those viral low doses by those who are infected. Now, let's talk about monitoring and evaluation of these implementation and of these interventions that would be completed by me and my community. We would want to monitor the PrEP program enrollments and then collect feedback from different events and track HIV trends quarterly. Now, we'll go in detail in the next slide just to see exactly what each of those mean. So, first evaluation criteria, we would track pre and post intervention data. Now, this is something that I read according to the CDC in 2024. We would use local health department data to monitor changes in new HIV cases and testing rates before and after outreach efforts. From this, we'd be able to analyze to see if these efforts that are being made are actually helping or not at all. Another option we would use to evaluate to see if this is actually beneficial would be using surveys and feedback forms. We would pass out anonymous surveys at clinics, schools, workplaces, and common gathering areas to assess awareness, understanding of prevention methods, and access to services. Now, this was research that has been also completed by UNAIDS in 2022 as well, that has been proven to be very successful and resourceful as well. And the last evaluation criteria would be monitoring viral load metrics through health records. Now, what's very important is that we would need to partner with local clinics to track viral suppression rates using electronic health records. Of course, this comes with its pros and cons just because we would have to access health records. There's a lot of legality behind this just because a lot of this information is confidential. But when it comes to partnering, obviously getting legal access to all this, we would be able to track these viral suppression rates again just to see that people are following through with treatment, they are following through with their follow-up appointments, and they are following through with their medication regimen. At least then we would see that this trend would show whether or not it is beneficial or not. This also would show the measurement of treatment success and the impact of early diagnosis over time. This was a study done by Ryan White, according to Ryan White, an HIV/AIDS program implementation for HIV clinical quality improvement. It has been shown to be successful to track these viral suppression rates in order to see if it's beneficial or not as well. In conclusion, we would, like spoken before, HIV is the focus. It's an epidemic that is happening currently in South Florida, primarily in Fort Lauderdale, Florida. Something that needs to be addressed because it is the second highest city in the US infected by HIV. Now, it's very important that we would address this issue by expanding testing sites, distributing free condoms, and again, education. It is extremely important that people are educated on this epidemic as well. And like spoken before, mentioned before, with South Florida being a melting pot, having many diverse races and ethnicities down in the South Florida area, it's very important that these education options are provided in different languages so all feel welcomed and comfortable to read and address what's happening. So again, more than likely we'd focus more on English, Spanish, and Creole. Like mentioned before as well, we would monitor the PrEP program enrollments. We would collect feedback from events to see if the education being provided is actually beneficial and helpful and resourceful for them. And then tracking the HIV trends quarterly, as well as partnering with local clinics just to see how the viral suppression rates are trending, whether or not they're coming down or continuing to go up. But this is my presentation. Thank you for listening. My goal, really and truly, in this city and community is to bring down the HIV rates. A lot of people are infected. A lot of people don't even know that they're infected. It's a huge, huge, huge epidemic. Um, it'd be a very important project to me to actually follow through with and hopefully see come through and become successful. Thank you so much. And on the last slide, I did provide references just to kind of follow where I receive all my information and education. So, thank you for listening and thank you for watching.